I have 30 neighbours in this wee clachan where I stay. We all know each other. And in the past couple of years, there have been many interventions from the Scottish NHS. Many are on free prescriptions. Most have had visits to the GP. There have been flu and COVID and shingles jags. There have been visits to the opticians, dentists and physiotherapists. There have been many home visits from GPs and opticians. Ambulances have been frequent visitors. I had a new hip. 2 people had new knees. 1 has a new elbow. 1 has had treatment for prostate cancer. 4 had prolonged hospital stays. And 1 has had multiple hospital appointments for eye problems. 1 has had stents to keep her heart beating. 1 person is confined to bed. 1 Wayne was born. I'm sure there are other treatments of which I am unaware. That is in just one wee place of 20 houses and 30 people. In the United States of America, that would have accounted for millions of dollars. Only the rich and those whose jobs provide insurance, or those who can afford to pay themselves just by being in Scotland. All of this is free. It is of the highest standard. At times the system is stretched. Sometimes there's a surge in demand and people have to wait. But at least there's something to wait for. In some countries, there will be no service to wait for. There are more older people. There are new illnesses and new cures, new equipment. Sometimes things go wrong, and sometimes people die. But millions thrive and live healthy, long lives. All because we have the Scottish National Health Service. Health and all the issues that surround it are very emotive subjects. And of course, emotions run high when people die and things don't go as people think they should. Neil Gray has been Scotland's Cabinet Secretary for Health and Social Care since the 8th of February 2024.
So what is the NHS doing here in Scotland that you don't get anywhere else in the UK? First of all, you get free prescriptions, you get free eye tests. These are services that are available here in Scotland that are not available anywhere else in the UK, or are not available to the same extent as they are here in Scotland. We also have the best performing accident emergency units. We have more GPs per head of population. We now have GP walk-in services, so that it means that people can get to see the GP without having to worry about the 8 a.m. rush. And what does that mean? It means that our outcomes in the health service are also getting better. We've got more operations happening. In 2024, a record number of hip and knee operations. We also have cancer services that are delivering for people where when there's a decision taken to treat a cancer, the median wait time is just 2 days. From the decision to treat to when your treatment starts, 2 days. And that has led to Scotland having a record low mortality risk for cancer here in Scotland. So that just serves to illustrate very briefly what the SNP has done to invest in our health service, what that means in terms of the delivery that's come from our incredible health service staff, and what it means in terms of outcomes for our patients. That's why I hope that we have an SNP government returned so that we continue to improve our health services here in Scotland.
And what about the mental health services?
Mental health services are critical to people across Scotland. We've seen a rise in demand, and we're looking to meet that rise in demand through better community services, better acute services, and making sure that we're employing the right people in the right place to ensure that people get what they need.
So, because you and me, we had our hips done. I had mine done October 3 years ago.
Mine was October day. It's about 2.5 years since I got mine done.
What was it like when you were in the hospital?
I think it was great because I thought they were only going to look at my hip. I don't know if it was a nurse. She says, "How are you coming across?" I says, "Oh, my daughter's going to bring me across in the morning and come back for me the next day." She says, "Oh, she'll not be coming back the next day." And I'm saying, "Why?" She She says, "You need a complete new hip, so you'll be in for about 3 days." So I went in on the Wednesday and I was there to the Friday. I mean, the nurses and that were great.
Since then, so 3 years in, your hip's pretty good now.
Oh, it's great. But it's this one that's starting to go on.
All right. So if you can get a new one for the other side, you'll be up and running again, playing football.
It's the village, it's all steps. Because when I went to see about this physiotherapist or something, or whatever you call it, and she was wanting me to do 10 steps like this, 10 like that, 10 like that. And I says to her, I says, "Hen, see when I go to the shop in the morning, I says, I've got to climb about 80 steps." And I never heard any word about it again.
Independence gives us the opportunity to entrench the things that matter to us. We will ensure that access to our National Health Service remains free at the point of need as a fundamental right. While others flirt with privatisation, Conference, let our party be clear. Scotland's NHS is not for sale at any price. Our health service will never, ever be privatised. Our message in this election is simple. Your first SNP vote elects an SNP government. Use it to vote for a better NHS, for GP walk-in clinics, for help with the cost of living, for the first-time buyer's deposit, and a massive increase in childcare that leaves no one behind.